Welcome to another episode of Health Matters with PA Lynn Szabo. I'm Heather Polen, and what are we going to talk about today, Lynn?
Basic medical education on the lymphatic system.
Ooh.
Or as we call them in Del Norte, lymph-noids.
I gotta love the noids.
Yeah, which is like one of the delightful things, and I really mean that, about practicing medicine in here is you have to figure out what people are actually saying to you. But they're not called noids, they're called nodes. Lymph nodes.
Lymph nodes.
Nodes.
Okay.
So this is an organ system that's only in vertebrates or, animals that have spines.
Oh.
So it's kind of evolutionarily a relatively modern development. And lymph nodes are part of the immune system. And the immune system, particularly with lymph nodes and lymph vessels.
You almost said noids, didn't you?
I know. So I'm getting all confused. Parallel the circulatory system. So it's kind of like if you think of how blood circulates through your body, there's also a network of vessels, nodes, organs, tissue, and fluid that's for lymph.
Oh.
Yeah.
And it just runs right along with your circulatory system. Well, that's kind of handy.
Oftentimes next to it. Think of it as two, like a main highway and a frontage road.
Okay.
Okay.
That's really intelligent design right there.
Yeah, I totally think so. Yeah. Why reinvent the wheel, so to
Right?
speak? So the Latin word for lymph is a reference to the freshwater goddess Lympha, which I think is so sweet because it kind of looks like water, For the most part, it's either clear or slightly yellow. Sometimes it has blood in it. So it's an open system that starts inside the tissues, and this lymph will leak from the cells, kind of float around in the tissues, and then get carried to the actual vessels, lymph vessels. And its job is to carry nutrients and take away waste products. So it's kind of doing the same thing as blood does, but here's what's different, is that it's taking it away to the nodes, which are like little balls that we have along the road that is the lymph system, and more importantly, the spleen, which is a big lymph node.
Oh, that's what it does. I always
Yeah.
wondered what your spleen did.
Yeah. And it also provides immune defense. So what they're doing is they're looking for the bad guys, and it's a system to kind of carry invading organisms or, viruses or toxins that shouldn't be there and to filter them out.
Okay.
Okay.
So that's why when we get sick and things like that, we can feel the ones in our neck or something
Yeah, we have
become tender.
We have a huge system of nodes everywhere, and people are most aware of the ones under their arms and the ones in their neck. But there's also ones kind of behind your clavicle, which is your collarbone. There's ones that parallel your intestines because a lot of toxins come in via food. Okay.
So there's just like the hubs to get rid of the yuckies
Right. And
all along the way of this highway of...
Yeah.
Wow,
it's
that
kinda
is
like
really cool.
The cleanup system. Okay. So blood does a little bit of that, but this does more because it actually carries the bad guys, immobilizes the bad guys and carries them to, say, the spleen, where they're taken apart and made untoxic, and then they go on to the next step, which is outside the body.
Nice. So like my gardening brain just tells me they go to the spleen to be composted and made safe.
Right.
That's awesome.
So I think
this is a good topic. I like this one.
I think of it as a system of roads with little guard stations. That's what the nodes are.
Nice. I get that visual in my head
They are
now.
the first line of defense to keep germs from moving deeper into the body. So that's why we have them at the groin. That takes care of the legs. Also, some of them might drain problems in the pelvic organs. And having them along the intestines helps take care of stuff that comes in through eating. Like if you went with the 5-second rule and you picked up that piece of candy from a gas station bathroom floor.
No, the 5-second rule doesn't apply in that situation. It applies in your own kitchen.
Clearly. Okay.
Okay. That just stays there. Nobody touches the bathroom floor at a gas station, Lynn.
Oh, God. Yeah. Good point. So lymphoid organs are connected all along the way, and these are staging sites also for resources. Okay, so they have a logistical purpose. And most of these little soldiers are known as types of white blood cells. So the node is made up, think of it as a guard station, and the white blood cells are little soldiers, and they hang out at the guard station.
Wow.
So like if you were crossing...
So they're little sentinels. They're keeping the base safe.
Right. Like if you went to Medford and you went by the bug station, and they're looking to make sure that you don't bring in something that would threaten California agriculture. Okay?
Okay.
Yeah. They're trying to keep a certain area safe. All right? So... Most of the soldiers of this type are known as lymphocytes, okay? And what that just means is they're white cells.
Okay.
Yeah. Another job of the lymph nodes is taking away debris that's then filtered out and disposed of. That's probably mostly from the gastrointestinal system. Your GI system is actually one of your biggest immune defenses.
Okay.
And it took us in medicine a long time to figure that out. But if you think about your GI system from your mouth to your bottom is like a donut, right?
Okay.
So inside the tract is the hole in the donut, right? And outside the tract is the donut. Can you picture that?
Yeah.
Okay. Then it's important to protect the inside of the donut.
Okay.
Yeah, from people who might want to eat it, I guess. But
so like little bacteria and pathogens and everything else.
The first time I figured that out, I was probably 10 years in medicine and my mind was blown.
Yeah.
We're donuts. We're actually donuts. Anyway. But
Can I be a maple one?
Yeah.
Okay.
So what that means is that the inside of your intestines are protecting you from the outside world.
Okay.
That's really what that means. And not only are these lymphocytes there in large numbers, but there's also mucus that kind of acts as like a way to, if something crossed over the barrier or was in the process of crossing over the barrier, it could get stuck in the mucus.
Okay.
Okay. So that means when people poop out mucus, as long as it's not bloody, they can be at peace with that.
Okay.
There's always a comment, always a picture.
I'm so glad I don't have your job just so I don't have to see that picture.
Yeah, for the most part, if there's no blood in it, it's just part of your normal system.
Okay, so if there is mucus, since we're going to talk about that anyway, so is that just possibly because your body is responding to a pathogen that it was exposed to, and this is what it's doing?
Well, it's normally there anyway.
So it's just
It's
normal.
just moving it along.
Gotcha.
So it's just cleaning it out.
That's supposed to happen. I gotcha.
Okay, so the biggest lymph node, I almost said it, lymph node is the spleen. And the spleen's pretty big. It's about the size of a grapefruit, I'd say. Yeah, I felt one that was a grapefruit size yesterday, but or maybe a largish orange. It's located in the left upper part of the abdomen, and it has 3 functions. So it's kind of an important thing, and so many of us, for usually traumatic reasons, don't have one. So I'll speak to that in a minute.
Okay.
So its 3 functions are to produce cells that fight against invaders, that makes sense, to filter out undesirable material, and to produce red blood cells in a fetus.
Oh.
Yeah.
Wow.
Yeah, cool.
That is pretty cool. So what, if you don't have a spleen, what produces the red blood cells in the fetus?
Well, if you're a fetus, you haven't had a chance to have your spleen out.
Okay. I'm thinking of the mom being pregnant and this.
No.
Okay. So
no, this is the
when you're a
spleen
fetus.
inside the fetus. So it's producing red blood cells.
That's awesome.
I know, super cool. And that, just as an interesting factoid, sometimes the fetal red blood cells and DNA material will cross over into the mom's blood.
Yeah.
That's how we do that test that people call the gender test, but really it looks at a bunch of different genetics besides gender. And the cool thing about that is a woman who's carried a child to term always has little pieces of that child circulating around in her system or stashed away in a drawer somewhere.
Yeah, piling up on her brain.
Yeah, that's kind of cool. So the spleen is composed of two parts. It's a white pulp and red pulp. So white gushy looking stuff and red gushy looking stuff. So the white pulp helps supply immune cells, and the red pulp is responsible for getting rid of stuff. So getting rid of germs. And then it also has a specialized function where it plucks out the aging red blood cells. The red blood cells, when they're not functioning super good, they might be dinged up a little bit. I think they're getting close to the end of their lifespan, which is about 45 days, and they're filtered out by the spleen. So that's a type of pathology that the spleen could have that I've actually seen in my career, where the spleen goes a little crazy and tries to filter out all of them.
Oh.
Every red blood cell.
Oh, that's no good.
Yeah, so it goes a little bit out of its lanes and beyond its job description. And then in some circumstances, the spleen has to be removed because it's
so to stick
bad.
with your soldier analogy.
Yeah.
Those are the spleens that go from being the Department of Defense to the Department of War.
That's right. And these red blood cells, interesting factoid about them, is they're broken down into recyclable parts and trash. And then the trash, which is usually breakdown products of the hemoglobin, which is a chemical that carries oxygen in red blood cells, makes your poop brown. It's excreted through the intestines, and that's why your poop is brown. So another reason that your provider is not super interested in whether your poop is green or yellow or, has mucus in it, or here's the picture of it, it looks weird. As long as it's not blood, we're not worried about it. Okay?
Okay.
I know, mind blown. I see your face over there. You're like, what?
Yeah, really?
Is that really? Yeah, that's kind of cool.
That is. I had no idea.
Yeah. You can live without a spleen. And spleen removal, like I just said, happens because of trauma, like car accidents, infections. Like if somebody had really bad mono and their spleen just wasn't, was dangerous that it could rupture. It's a really vascular organ. So when it gets, like a traumatic blow to it, say an elbow during a soccer game, it can kind of explode.
Oh.
Yeah. Autoimmune problems, which is the filtering out red blood cells with merry abandon instead of judiciously. And then, of course, tumors. I mean, cancer happens in lymph nodes, and the spleen is a lymph node.
Okay. So with all of the things your spleen does to remove the garbage and, give us fun-colored poops,
right?
What do the people who... because I've literally thought the spleen did nothing, and it does all of these amazing things
no, it does
to keep us healthy.
Yeah.
What do we do when we lose our spleen? Is like a...
So that's kind of important. And on the operating table, they will immunize somebody that's just had a splenectomy for pneumococcal disease, because the spleen is particularly good at helping the body fight a certain type of bacteria that's kind of encapsulated with its own little protective device.
Okay.
And the spleen is like not having it, and it'll identify it and filter it out. And
okay, so we have medical things that give that extra support that your spleen's no longer giving you.
Right, so if somebody is missing a spleen, they're at more risk for severe pneumococcal disease.
And that's pneumonias, right? Different types of pneumonias.
It could be pneumonias, it could be septicemia, it could be a lot of things.
Okay.
And there's an immunization for that. It's almost like a miracle.
Right? It is a miracle.
Yeah.
It's a miracle. It is a gift from God that we have these things at this point in time, that we have evolved as human beings intelligently enough to have these things to support ourselves and to live longer and to live healthier and
safer.
And safer, yeah.
Yeah, totally. So you can live without a spleen. There's a number of people that have had splenectomies. It's usually a big old scar. They usually don't even think about it. So I'll be like looking at their abdomen and wondering why they have a big old scar. And then I'll go, oh, yeah, I had my spleen out. So they get immunizations for pneumococcal pneumonia on the table.
Okay.
They also get immunizations for influenza and meningitis. My notes here say that it's on the table, but I think it might be shortly thereafter. But the pneumococcal one is so important, it's on the table, on the operating table. So like I said before, lymph nodes are like located in chains around the body. We're not really aware. We're aware of about 20% of them. And they respond to infections. They swell up Okay, so the little guard station gets activated, and all these kind of lymphocytes are working to protect you. And then they hang out kind of in a vigilant state and then get tender. And then over the couple of weeks, they slowly go back to their original state of awareness. Okay.
Okay.
So they swell up, they get bigger, they're tender, people notice them, they hang around enlarged for a couple of weeks, and then they slowly go away. And so people come in and they're worried about the lymph node being swollen, that there's got to be a terrible reason for it. Most of the time, it's just them doing their job. And about the time you forget to obsessively recheck it, it kind of peters out and goes away.
Okay.
Yeah. So oftentimes...
So that's just proof that you have a good immune system and that your body's doing what it's supposed to do.
That's what happens a lot to kids. And kids have, for example, small necks. And if you're looking at the chains... the anterior and posterior cervical that are located in the neck, you can see it when a kid turns their head. You can see a lymph node, and then the moms get excited. But most of the news is good. Okay, they're doing their job. So not all swollen lymph nodes are cancer. But if you're concerned, you always talk to your provider. It's easy enough to get an ultrasound, and if it looks like it's a suspicious problem, then they'll stick a needle in it. So. But many times the result is what we call benign, which means no big deal, just doing its job.
Okay.
Okay. So I want to address proximal streaking, which is a medical term for there's a line up my arm because I was chopping firewood and I got a cut on my finger, and now there's a line going up my arm. And my grandma said that if it gets to my heart, I'm going to die. So that's kind of a Del Norte understanding of what we call proximal streaking.
Well, yeah, that's everybody's understanding of it because grandma says. So it doesn't...
No diss to grandma. But this, when there's an infection, say on the finger and the foot, and the lymph system is activated to help protect the body, there's a visible streak up an extremity.
Yeah. And that's a severe infection, and you got to go see the doctor. That's not a play around thing because you're going to die, because that's what grandma said.
That's what grandma said. And then when you get to the doctor, they're mildly interested in it, and they put you on antibiotics and reassure you that it's not going to go to your heart and die. But it is a good reminder that you need to seek medical care for that particular wound.
Okay.
But I don't think it would go to your heart and die. I think the worst case scenario would be if it was left ignored, that somebody could become septic, which means...
Then they're going to die.
Yeah, sepsis has a high fatality rate. But it's not literally, it's going to your heart and you're going to die.
I'm just trying to, I get it. I'm just trying to defend my grandma.
Okay. Well, all due respect, I listen to most grandmas.
Yeah.
So there's a nugget of truth in there.
Yeah, I was going to say that, and that's exactly what it is, right? If we're not going to listen to the whole thing, this is the process. If you see that streak, you need medical attention. If you ignore it, it's going to continue to get worse.
Yeah. And
you're going to get sepsis from the infection. So it's just a symptom of go to the doctor.
If you can't get an appointment in a reasonable amount of time, come see me on Saturday.
Okay.
It's easy enough to fix.
And now you're talking about the Saturday clinic at Open Door here in Del Norte County, and that is from 10 to 1:30?
Yeah, 2-ish, 1:30-ish.
So you see the last patient at 1:30 and it's closed at 2. Okay. That was my understanding of how that worked. Okay. So it doesn't directly go to your heart like grandma said, but...
Not quite.
But grandma gave us enough of a warning that we would remember it generation to generation.
But if that's what get you into the clinic, I'm all for it.
So it still needs to be treated. It's still serious. It's just not, it doesn't happen the way grandma said.
No.
Got it. So we can still trust our cookie recipes too, though, right?
Oh, well, don't eat raw eggs.
I love you, Lynn.
Excuse me, but I wanted to take a couple minutes to talk about an upcoming ballot measure that's on, I think, the November ballot in California, or it's headed toward the November ballot. And we're going to talk about this in more detail later on, but it will, I think the intent is to affect the community clinics and patient care in a good way. Okay. So it's still getting, people are still getting signatures, so it's not definitively on it.
Are you referencing the SEIU ballot measure?
Yeah, nonprofit safety net health clinic expenses. and you can look it up at the California Legislature Nonpartisan Fiscal and Policy Advisor online. And I'm looking at information that was filed on November 22nd. Okay. So AG file number, if you're interested, 2025-008. So this nonpartisan discussion about it says that the measure would require nonprofit federally qualified health centers, so what are called FQHCs, which used to be called, I think, 95-210 clinics, of which we have a number in this community.
Yeah.
Open Door is one. UIHS is its own form of one. Sutter Community Clinic is one. The old walk-in clinic that Sutter had is one. Stallant is one.
So all of our providers are essentially our largest providers would be affected by this.
And it's requiring these health centers to spend at least 90% of their annual total revenue on expenses that advance the mission, FQHC's mission, which is to provide primary care service to medically underserved groups. So that sounds to me like a good thing.
It does. When I read it, because I've read this too, and we've talked about this very briefly. And again, right, I'm not a provider, but I do help people in the community connect to resources to remove barriers to care. When I read that, it was you had to spend 90% on direct patient care. Mm-hmm. So things that directly affected the patient in support of their mission. Right. So, yeah, it sounds like it's a good thing, but it's my understanding that these community clinics are opposed to it.
Right. So I'm curious about that. So hoping to get maybe the CEO of Open Door, Tori Starr, to come and talk to us about it. Something that seems a little abstract right now, but it was definitely on my radar when you sent me the link to it. I don't know that UIHS is aware or paying too much attention to it because their situation is way different.
Yeah.
I don't know how it's going to affect Stallant, for example, because their situation is way different. I have no idea how it'll affect Sutter because their situation is levels of complexity more.
Right.
Right.
And I can see where right. So if I put on a business hat here and I look at it from a CEO perspective, right? Mm-hmm. How am I going to pay my IT? How am I going to pay my HR department? How am I going to pay for maintenance on the building? How am I going to do these things, right? And we see the effects of things like this that we think are good when they start that aren't. They end up having harm. Right. We see this on dilapidated schools, right? Mm-hmm. You cannot spend money on the maintenance of the building, and then we wonder why they fall apart. Right. So I can see where there'd be issues there to those types of things. But when I looked into the finances, because that's all public information, right? You can go to ProPublica, any 501c3, all of their tax filings are going to be there. And they're usually about a year behind, 2 years behind. So you're going to find Open Doors, I think, are current to 23, possibly 24. Right. And then obviously they haven't filed 25 taxes. But it's not like they're paying $2 million to their CFO and their COO, right? Or their CEOs or anything else.
I don't think at Open Door that's the case.
It's not.
It might be at Sutter.
It might be at Sutter. But it looks, so if we look at just Open Doors, because that's the only one I looked into, to me, it looks like they would meet this criteria without an issue. Like it wouldn't be a problem.
Right. So for almost all of these clinics, there's a middle management component. It's not directly related to patient care, but is more related to like making sure grant requirements are being followed. It depends how you define this, but Open Door has huge middle management down in Arcata, and it's always been, I think, a legitimate concern that maybe they're overdoing it on that level, and they need more. Actually, they need more providers, more hands-on, more. Yeah, people in their clinics, and not so much, the people who are planning provider lunches, and stuff like that.
And again, when I looked at the open doors, and again, I only looked at open doors. I did not look at Sutter's. I did not look at Stellantis or anybody else's. It doesn't look like that they have because you have to budget those things out. So the pay for their executives is there. You can see it, and it's not. It's six figures, but it's the low six figures. It's probably not much more than what the providers are making. And it doesn't seem that they have a whole bunch of people within that category that are doing that are not providers.
Right.
We're a 501c3 here with KFUG. It's a pain to do the grant tracking and making sure that the money gets spent with the grant thing. So that's where maybe this is more than just a discussion just with Health Matters with these people. Maybe we have a community discussion and we talk about these things of what can be done better and what we want to see happen. What I don't want to see is I do not want to see people forming an opinion based off of fear, not facts.
Right. So I also
because I don't have one yet.
I also think that part of it is rolled up in unions, and so they're trying to unionize the community clinics here. And this has been going on for I don't know. I've been aware of it for 20 years, and you have frustrated, burned out providers.
Yes,
and that sounds really good to them.
No,
but I think this is rolled up into it.
Okay. Well, and it is coming from SEIU. I can't remember the union number with SEIU, but if I'm not mistaken, it is the largest union with healthcare workers in the state of California. And it makes sense to me logically. If these are the healthcare workers saying, hey, you need to do this, it's going to benefit you, you would just support it.
Right.
But again, in our area, I think these things are nuanced and we need to understand the nuances.
We totally need to do it. And that, at the same time, that union is putting stuff, I don't think it's just me, but stuff is showing up in my Facebook and my Instagram feed about, have you observed illegal activities at a community clinic?
Wow.
So they're trolling for badness. And I think that the clinic administrations are aware of that.
Okay.
Because they weren't surprised when I said, what is this about?
Yeah.
And, that to me, it sounds like everybody has an agenda.
I was just going to say, when you have an agenda and you're using fear, that to me, that is a problem.
Yeah, we need to be really careful about how we vote for this if it makes it to the ballot in November.
Yeah, and I do think this is something that we are definitely as a community.
And it sounds good.
It does. It sounds good.
Of course the money should be paid.
Spent on the patients.
On patient care, absolutely.
Yeah.
But if you're a provider and you're seeing patients at these clinics, it's one big slog of fighting barriers to care.
Yeah, and it's true. Our providers in our community, with the burnout and what they're expected to do, the number of patients that they have, the frustration of trying to get them to see the specialists that they need, and the wait times, and they don't have transportation, they don't have the time off of work. I mean, there's so many.
Right.
There's so many barriers to our
the people who have
here.
No medical experience who are deciding what's a legitimate referral or not.
Yeah, maybe we should put that on the ballot measure.
Yeah, totes.
Yeah, so it does. Yeah. I'm glad that we can have this conversation and just to say we don't know enough to have an opinion. But I do think I think I would like to work on getting that. And I'm not to be one of those people to do the both sides.
Totally.
But to talk with the union of what it is. I don't even think the final language has been put out yet, so that we don't have anything on it. And I mean, I looked at the cost of what it's going to cost the state, and they anticipate a little less than $10 million per year. It would be enforced by the Attorney General's office.
Right.
And so what are the guidelines around that? There's so much that we don't know.
Right. So we're the little lymphocytes at the guard station who are alerting the body as a whole.
Nice.
Think about this. Do real research on it. We'll certainly be bringing you information. But this sounds good, but it looks sketchy.
Right. All around, I think. Right. And again, I don't like, because I've seen some of the material coming out from the clinics and stuff too. And to me, it feels like fear mongering.
Yeah.
Which always makes me suspicious. And I have not seen anything on social media or anything else coming from the unions that way. But that's fear mongering, which makes me suspicious. Because if you unionize all of these clinics, right, that's union dues. It's always follow the money, and that bothers me. So
right. And none of it is going to be personalized to what rural communities need or this community in particular needs.
Have a huge impact on our community, whether
these
it
are
passes
people
or not.
out of our area who are making decisions, so we shouldn't rush into anything. So lots of information needs to be collected, and we'll be talking about this over the course of the year.
Sweet. Thank you so much, Lynn.
Yeah.
You have listened to another episode of Health Matters, and I particularly love this one. Thank you for all the visuals. That helped me understand it immensely. If you'd like to listen to this episode again, you can go to KFUG YouTube's channel, KFUG Community Radio, and select it from the playlist and listen to this or any of the other 7 years worth of episodes of community service that Lynn has provided to us. What are we going to talk about tomorrow or next week?
Next week, I don't know yet. We'll see what the week brings me.
Oh, I'm intrigued.
We could go rogue.
Uh-oh. All right. I'll see you next week, Lynn. Thanks.
Alrighty. Bye-bye.
Bye-bye.